Hello, this presentation will compare and contrast the Nurse Practice Acts in regards to the nurse practitioner scope of practices in the states of Alaska and Illinois, presented by Nurse 540 Group 5. First, we will discuss a few similarities of the scope of practice of Alaska and Illinois. In both of these states, nurse practitioners may sign disabled persons placard forms, refer patients to physical therapy, and also sign physician's orders for life-sustaining treatment forms. Neither Alaska nor Illinois participate in the Nursing Licensure Compact. In addition, both states allow nurse practitioners to prescribe Schedule 3 to 5 medications as well as Schedule 2 medications, although nurse practitioners in Illinois are only limited to a 30-day supply. Now that we have described some of the similarities between Illinois and Alaska's nurse practitioner scope of practices, we can also discuss some of the differences. To start, in terms of autonomous practice, Illinois has reduced practice, which means that physicians and nurse practitioners must enter a collaborative agreement for one or more elements of the nurse practitioner practice unless clinical privileges are authorized by the hospital affiliate. In Alaska, they have full practice, which means nurse practitioners are fully authorized by state law to see patients and provide them with diagnoses as well as prescribe medications. In terms of being labeled as a primary care provider, Illinois has no law, so the state does not define whether or not a nurse practitioner may be listed as a primary care provider. In Alaska, they have full practice, which means that nurse practitioners are recognized as primary care providers by the state statute and administrative code. In terms of being able to independently prescribe Schedule II drugs, Illinois is a reduced practice state, which means that their prescribing authority is dependent on collaborative relationships with physicians, the drug type, and completion of pharmacology courses. Schedule II drugs may only be prescribed in 30-day quantities by nurse practitioners. Contrastingly, in Alaska, which is a full practice state, nurse practitioners may prescribe Schedule II medications upon completion of 12 biennial CE hours and in advanced pharmacotherapeutics by ANPs and CRNAs. Moving on, in terms of prescriptive authority, Illinois requires a physician collaboration for nurse practitioners to prescribe medications, whereas Alaska does not require physician involvement for nurse practitioners to prescribe. In terms of educational requirement, in Illinois, a nurse practitioner must have at least 45 hours of graduate pharmacology and annual completion of 5 hours of continuing education, whereas Alaska requires 15 hours of advanced pharmacology and clinical management of drug therapy. Alaska also has some current legislatures in place in order to advance and improve their practice. One of these legislatures is Senate Bill number 53, which seeks to update the statutory title from Advanced Nurse Practitioner and Anesthetist to Advanced Practice Registered Nurse. As you can see from these graphics, one benefit of this title change would be to help decrease role confusion. This title change is projected to have many benefits for nurse practitioners in Alaska. In addition to decreased role confusion, it will decrease confusion regarding financial reimbursements from insurance companies, Medicare, and the Department of Veterans Affairs. Another benefit this title change will have is that it will put Alaska into full alignment with the National Council of State Boards of Nursing's APRN consensus model. Another recent change to legislature of APRN practice in the state of Alaska includes educational requirements that must be met in order to prescribe controlled substances. All new applicants as well as renewal applicants who hold a DEA number must complete 2 hours of continuing education that is specific to pain management, use of opioids, and addiction. This education will count towards the total number of hours required for a renewal of licensure every 2 years. If this education is not completed, APRNs will not be able to prescribe controlled substances to patients. In conclusion, there are many differences and similarities in the Nurse Practice Acts of Illinois and Alaska. The main difference between the two is that Alaska does not require an NP to work with a collaborating physician. Therefore, they are recognized as primary care providers and able to practice independently, whereas Illinois is a reduced practice state. Also, Alaska is working on legislatures to clarify the title of the nurse practitioner role to decrease confusion and promote unity among subspecialties, as well as requiring education in order for NPs to prescribe Schedule II controlled substances. Here are our references. Thank you for taking the time to listen to this presentation.